Getting a diagnosis of an ectopic pregnancy, well, it's a really critical moment. So, the big question is, what happens next? Today, we're going to walk through the crucial decisions, the treatments, and the recovery process that follows. Let's dive right in.
And yeah, that really is the central question here. As soon as that diagnosis is confirmed, it kicks off a whole chain of really important decisions. And, it's so much more than just a medical procedure. It's about navigating a really complex and, honestly, an emotionally charged event.
It truly is a crossroad, a major medical decision point. There is absolutely no single, one-size-fits-all approach here. The right path forward really depends on a very specific set of clinical factors, which we're about to break down right now.
So this is basically the decision-making framework. Doctors have to weigh all these factors together. First off, is the patient hemodynamically stable? Are their blood pressure and heart rate okay? Then, where is the ectopic mass located and how big is it? What are the levels of the pregnancy hormone, beta-HCG, telling us? And, this one is absolutely crucial, what are the patient's own wishes for future fertility? All of these pieces have to come together to guide that next step.
So once you've looked at all those factors, the options really start to narrow down to three main strategies for management. Each one is designed for a completely different clinical scenario, ranging from just careful observation all the way to active, hands-on intervention.
The first one is what's called expectant management. And that's pretty much what it sounds like. In some really low-risk situations, the best move is just to wait and watch, to carefully monitor things and see if the pregnancy resolves on its own. The other two, medical and surgical management, well, those are the active treatments we're going to focus on now.
Okay, so let's dive into the medical route. This almost always means using a drug called Methotrexate. So how does it work? Well, it's a folic acid antagonist. Think of it this way. Rapidly growing cells, like the ones in a pregnancy, desperately need folic acid to divide and grow. Methotrexate just blocks their access to it. It basically starves those cells of what they need, which stops the growth and lets the body absorb the tissue over time, all without any surgery.
Now this is really important. The dosing here is incredibly specific. The standard is a single-dose regimen of 50 milligrams per square meter of body surface area. It's not a standard pill you just take. It's calculated precisely for each patient and given as a single shot, an intramuscular injection.
But, and this is a big but, methotrexate is not for everyone. There's a whole list of safety checks or contraindications. For example, if the ectopic has already ruptured or the patient is unstable, it's off the table. Same goes if there are underlying kidney or liver problems, blood disorders, or a compromised immune system. It's a powerful drug, so patient safety has to come first.
So that naturally leads to the next question, right? What happens when medical management just isn't an option? Or what if the situation is already an emergency? Well, that's exactly when surgical intervention becomes the necessary path.
When surgery is the answer, there are generally two main procedures. The first is a salpingostomy. Here, the goal is to try and save the fallopian tube. A surgeon makes a tiny incision in the tube itself and removes the pregnancy. This is really the ideal choice for someone who wants to have children in the future, as long as the tube isn't too damaged. On the other hand, you have a salpingectomy. This is the complete removal of the affected fallopian tube. It's the necessary choice if the tube has already ruptured, is severely damaged, or if the patient has decided they've completed their family.
All right, we have to shift gears a little bit and talk about the risks, because this is serious stuff. An ectopic pregnancy is a major medical event, and unfortunately, complications can pop up from both the condition itself and from the treatments used to fix it.
The absolute #1 most acute danger here is tubal rupture. If that growing pregnancy breaks through the very thin wall of the fallopian tube, it can cause massive, life-threatening internal bleeding. This is the very definition of a medical emergency, and it's exactly why catching this early is so vital.
And it's not just about the rupture. There are other complications to think about. The condition itself can lead to dangerous blood loss. That's hypovolemic shock. And looking long-term, it can impact future fertility or raise the risk of another ectopic down the road. And the treatments aren't with their own risks either, from the side effects of methotrexate to things like internal scar tissue or adhesions that can sometimes form after surgery.
So, after all that, what does the path forward actually look like? Once you're through the immediate medical crisis, the focus really shifts to recovery, to careful follow-up, and to understanding what the future might hold.
The care that comes after the treatment is absolutely meticulous, and for good reason. For women with an Rh-negative blood type, a special injection is given to protect any future pregnancies. Then comes the follow-up, Weekly blood tests are essential to track those pregnancy hormone levels all the way back down to 0, confirming the ectopic is completely resolved. And just as important is counseling, which is such a key part of the emotional and physical recovery process.
And that, of course, brings us to the question that's on so many people's minds. What about future fertility? The data gives us a pretty realistic picture. About 65% of women go on to have a healthy pregnancy inside the uterus. But there is about a 15% risk of having another ectopic pregnancy, and for about 20%, infertility can sadly be a long-term outcome.
Okay, so we've covered a lot of ground. Let's boil it all down to the most critical takeaways. Here is a summary of the absolute key points you need to remember about ectopic pregnancy.
Ectopic pregnancy is implantation outside the uterus. The most common site is the fallopian tube. The most common cause is PID. The classical triad is amenorrhea, pain, and bleeding. The gold standard for diagnosis is a transvaginal ultrasound. The most common drug used is methotrexate. The main danger is hemorrhage and shock, and the main long-term risks are infertility and recurrence.
And that really leaves us with one final big-picture thought. When you consider that the main danger is rupture and hemorrhage, it makes you ask a powerful question. How much could we change these outcomes just by being more aware of the risk factors and catching this critical medical event as early as possible? Something to think about. Thanks for joining us.